Okay. Hello, everyone. Thank you so much for attending tonight's educational event here with Fusion Academy. My name is Mackenzie. For those of you who do not know me, I'm the Director of Admissions and Outreach for Fusion Academy Scottsdale. And in case you aren't familiar with who Fusion is, we are an accredited private school here in the Gainey Ranch area. And we offer a unique approach to schooling. We have all personalized one-to-one classes for our students. And this offers a complete customized learning experience for every student. Our brick and mortar campus is in the Gainey Ranch area, and we are opening next Monday on the 24th. So very excited to welcome those students who want to come back on campus with us. And then we will continue our online classes as well for those who prefer to stay remote. Just a few housekeeping matters. If you aren't already on mute, please go ahead and mute your line just so we can hear the speaker clearly. And if you have any questions, you're welcome to put those in the chat. And if we have time at the end, we will see if we can answer those. And you can always just shoot me a chat or privately or put it in the group and I will moderate that chat for everyone. And today we have the pleasure of learning from Dr. Sarah Bald on the important topic of oppositional defiant disorder, facts, myths, and hidden diagnoses. Dr. Bald specializes in pediatric neuropsychology. Her professional interests include assessment and consultation of early childhood development, giftedness, learning disorders, and executive function impairment. She works as an advocate to help your child get the academic support they need in school. Thank you so much for being with us this evening, Dr. Bald.
Hey, thanks for having me. I appreciate it. This is a fun topic to discuss for sure. One I know a lot of people have questions about.
Yes, yes. As you can see, there's a lot of attendees this evening, so I know it's a hot topic.
Absolutely, absolutely. I'm going to go ahead and throw my presentation on the screen. We'll see if we can I can figure that out. All right, can you guys see that? See if it'll let me go in presentation mode. There we go. All right, are you guys able to see that? I know I have a few of you on my screen, so I'll just look for your nonverbals to see how I'm doing. All right, so we're going to talk about oppositional defiant disorder. We're going to go over the facts of it, the myths of it, and all the hidden diagnoses that it may be masking. So, ODD, what is it? It is a frequent and persistent pattern of anger, of irritability, of arguing, of defiance, vindictiveness towards parents and other authority figures. Now, one key caveat with ODD that all clinicians will outline for you is that this cannot just be against siblings. So being aggressive towards siblings, being irritable or angry at your siblings does not in and of itself classify and qualify as oppositional defiant disorder. It has to be towards parents and other figures of authority. So there's three considerations for ODD. The first is, are there frequent moods of anger, of rage, and of irritability? So your anger and irritability are pretty obvious. Your rage are this child, this adolescent is not able to safely be in an environment. They're either a danger to themselves or they're a danger to others because they're so outwardly angry and aggressive that it turns into rage. Another consideration is argumentative and defiant behaviors. So these are your kids who are blatantly doing the opposite of what you've asked them to do. And the most important one is that there are spiteful or revengeful behavior for a period of at least 6 months. So, you know, some children, we'll talk about this more when we get to hidden diagnoses, might not follow your directions, but are they spiteful in not following your directions? Are they revengeful in openly defying you in front of other individuals? This is an important differential diagnosis of, is it ODD or is it something else? So the mood and behavioral characteristics of children with oppositional defiant disorder are that they often lose their temper or they go into rages. Like I said, they're not safe to themselves or others. They're easily annoyed and irritable. I think of these kids, they are just always irritable. There's no very rare happy moods with them. They're bristly type kids, if you know what I'm talking about. They're often angry, they argue with authority figures, They refuse to follow directions, and this is a refusal, not a they missed the direction, but they openly refuse to follow your directions or your commands. They're deliberately annoying others. Again, not siblings. We're not annoying siblings. We're annoying other people. They'll blame others for their mistakes, so there's no sense of personal responsibility with these kids. They're revengeful, they're spiteful, and they are unforgiving of others. So those are the behavioral characteristics. Many children display oppositional behaviors, but they might not necessarily have oppositional defiant disorder. So under the DSM criteria, kids have to meet at least, I'll go back to it, at least 4 of these for a 4-month period. So it's not just 1 or 2, they kind of do sometimes. It's very consistent within a 4-month period, they are doing these things. Or within a 6-month period, they're doing 4 of these things, 4 or more. Now, things to consider with ODD before it's diagnosed, at least from the clinical psychology standpoint. Developmental factors. Are there developmental reasons why this child or this adolescent is acting this way? Do they have an underlying autism spectrum disorder? Are they emotionally asynchronous from their cognitive development? That means that cognitively they can, a 10-year-old's going to be having conversations with you like they're a teenager, but emotionally they just haven't developed yet. So it's those developmental factors. Socioeconomic factors. What type of environment is this child raised in? What type of environment do they live in? Are they in an environment where they have to display these behaviors to survive? Maybe they have a parent who acts this way, so they have to act this way. They have to act tough to survive in their households. Maybe they've grown up in an impoverished neighborhood, whatever it might be. Are there social economic factors that are driving and explaining this behavior where others in their environment are acting like this? Same with environmental issues along the same lines, and medical issues. Medical issues can mimic ODD. If a child is refusing directions, if they're irritable and they're bristly, are they in chronic pain? Are they acting this way because they feel a lot of pain? I like to think of mental health issues as medical issues. Is there an anxiety disorder that's causing more escapism behavior, so they're fleeing from the classroom? What medical issues are underlying? Because the reality of oppositional defiant disorder is that it only has a 3% prevalence rate. So only 3 out of 100 kids are typically diagnosed and have and meet clinical criteria for ODD. Now, to put that number into perspective, ADHD, for example, has a prevalence rate of about 9 to 10%. In boys, it's about 12%, in girls, it's about 8 to 9%. Dyslexia is about 10% of the population. Food insecurity, not feeling like you have enough food in your households, that happens in 11% of the population. Diabetes is 11% of the population, and arthritis, 23% of the population. So ODD is very uncommon. But a lot of kids display oppositional behavior that are concerning in the classroom, at home, in every environment in their life. And so, I was a philosophy minor in undergrad, and one of the big discussions that we had was the idea of tabula rasa, that all of us are born a blank slate and we're kind of made and shaped based on the environment that we're born into. I tend to disagree. I think we're all born a little nutty. We're all born to push boundaries, to be oppositional, to test the limits with people. And so most people are going to display at some point in their life what appears to be an oppositional behavior. And a lot of kids are going to act oppositional, especially without protective factors that we're going to talk about in a little bit. So I'm going to discuss more openly oppositional behaviors than oppositional defiant disorder, because these oppositional behaviors we're seeing are still a clinical concern. It might just not be ODD per se. But these are all strategies that we're going to be talking about today that will help oppositional behaviors as well as oppositional defiant disorder. So common myths about ODD. There's a lot that's misunderstood about this disability. One is that it only occurs in young children. Like I said, little kids tend to push boundaries. I think about terrible twos, terrible threes. Kids are kind of roller coasters. They go through motions where they're testing boundaries, then we have an okay period, and then we're testing boundaries, okay, and then we have an okay period again. ODD can occur across childhood and adolescence. Now, if it's not treated properly, what we're going to talk about is it's going to go from oppositional defiant disorder to conduct disorder, which is much more severe. These are your kids that are setting fires, that are, truant, that are being arrested, which then can, again, without treatment, lead to an antisocial personality disorder when they're 18 and above. So ODD is not only for young kids, it can extend into adolescence and young adulthood. ODD and conduct disorders are the same. Like I just mentioned, conduct disorder, we are setting fires, we are doing terrible things to animals, we're doing much more significant behaviors where you're oppositional, it's a spectrum. Oppositional defiance, kind of on the lower end of the spectrum, antisocial personality disorders on the higher end of the spectrum, that conduct disorder falls right in the middle, where we're still engaging in very scary behaviors. So it's a little bit more severe. ODD is always the result of trauma. Absolutely not true. It can come out of trauma. So like I mentioned earlier, if we have a child who's raised in a household with a parent with ODD, with antisocial personality disorder, with conduct disorder, there can be trauma and it can lead to oppositionally defiant behaviors, but that isn't always the cause. There's other causes to ODD. ODD is always due to bad parenting. Absolutely not. Brain imaging studies show us that ODD, there are structural differences in kids who have a true oppositional defiant disorder than your neurotypical children. So it's very subtle differences, but it's in the part of the brain responsible for reasoning, for judgment, for impulse control, and problem solving. It might be a child who seeks reward and who is rewarded chemically by acting out behaviors. So it's not a bad parenting issue per se. It could be very much a structural and chemical imbalance within the brain. Punishment is the best way to correct ODD. This typically is the worst thing you can do for ODD, because when you start pushing against a kid with ODD, what's going to happen? There's a new line that you've set in sand. They're going to push and push and push until you break again. So punishment typically results in the opposite effect that you want for a child with ODD. You're going to get increased behaviors and a lot more turmoil within the home, within the classroom, whatever it might be. We're going to talk about other strategies you can take that work better for ODD. And then ODD is not treatable. These are your kids. I worked in a level D school, the emotional disability school. Some people give up on these kids. They think, oh, you're already like this way, there's no one doing this. Absolutely not. ODD is always treatable. Obviously, the earlier you catch it, the better the outcome, like everything else in life. But it's definitely treatable, and there is a way to help these kids. So let's talk about the big 10 of oppositional behaviors. So these are 10 behaviors that I am most concerned about when I'm looking at children and when I'm working with parents who have oppositional kids. The first, I feel like I hit this one over the head so far, but rage. Rage is very important. It's when a child is unsafe to themselves or those around them during a tantrum. So this is, I might be 15, but I'm throwing a temper tantrum right now. I'm flipping a desk. I'm, non-verbally aggressive. I'm trying to peacock to the authority figure in the room. I'm getting very aggressive with them. Escape. This can be kids who leave the building, leave the school, leave the home, or even just escape through distraction. So I don't want to be in the situation right now. I don't like it. I'm going to sit there and play video games even though you've told me 500 times to turn off my video games. I'm just going to escape from this situation, and that's why I'm being oppositional right now. The third is non-compliance. So these are your kids who are not following directions and or openly defying your directions. Now, non-compliance is interesting. When you think about something like OD or ADHD, kids are not following rules or not following directions because they might have missed part of the direction. So this non-compliance really is a tricky one as far as the big 10 behaviors. really look at the source of this non-compliance. Is that you don't want to do it, or did you miss part of the instruction? What's the reasoning behind that non-compliance? The next behavior is nagging. It's a learned behavior that results in poor boundaries with adults. So these are your kids who growing up, they nagged enough, they got what they wanted. I think of it too, you know, if you've ever been at a stop sign or in an elevator, I like the elevator example better. You ever been in an elevator, you get in and that one person is pushing the door close button and they're pushing it obsessively until the door closes. That's like nagging. It's a learned behavior. The first time they got in the elevator, they pushed the button, the door closed. Oh, this works. The next time they hit the door close button, it didn't close, so they pushed it again and again. Oh, it worked. Okay. So until we get to the point where I am now a 40-something-year-old woman or man staying in the elevator, pushing the button like a child, trying to get the door to close faster. Nagging works the same way. It's conditional learning. I have nagged you, nobody set boundaries with me, so now I've learned that if I nag enough, I get what I want. So I'm going to continue to nag, and if that worked with one adult, I bet it works with other adults. So consistency is definitely key with these kids, with any kids, both oppositional kids especially. Work refusal, it can be school, it can be an activity. It can even be an activity that a child loves, especially if they're refusing it just out of spitefulness. You want them to do it, they love that activity, but because you are asking them to do it, they're gonna dig their heels in the ground and not do it. So that's one of the oppositional behaviors. The next is yelling or verbal aggression. And the reason oppositional children choose this is it really is noise to create control in the situation. If I get loud enough, if I get big enough, if I get scary enough, I am now in control of this situation. So they've learned over time that yelling and verbal aggression is beneficial for me and it gets me what I want. Then there's physical aggression and nonverbal aggression. So this again is your peacocking. This is your, I'm getting in your face. I might be throwing punches. I might just be doing a fist up to try to scare you. Those are aggressive behaviors. Not following directions or no follow through. So I'm blatantly ignoring your directions, or I'm not following through even though I said I would, or if I had told you I'm not going to follow through with it. There's bullying, which is the physical and emotional intimidation. And then there's panic reactions. Now, of these Big 10, a lot of these behaviors are intentional. Panic reactions really are not intentional. This is stemming from fight or flight. I am now panicking. I'm in this panic mode, so now I'm fighting back, or I'm fleeing the situation, I'm escaping the situation. And again, it's typically set by adults in the environment not setting appropriate boundaries or setting appropriate limits. When kids have expectations, when things are done the same way every time, they know what to expect, they're going to be able to comply a lot better because they know what's coming up. So if we have a kid who's acting out oppositionally because of panic, the more consistent we can make the environment, the more likely they are to succeed. So those are the Big 10. Let's talk about the type of oppositional kids. There's 3 types. There's your traditional ones. These are your kids who have a family history of oppositional defiant disorder. It runs in the family. We're wired this way. This is our brain structure, ODD kids. Or they live in an environment where oppositional behaviors are needed for survival. So when I talk about ODD and oppositional, these are your traditional. This is why it's very much environmental or brain-based. Nature, nurture, a little bit of both. Now there's your kids with underlying conditions. We're going to talk about those next. But they are being oppositional because of a certain condition that they have that might be masked because we're so focused on the oppositional behavior that we're missing where the opposition is coming from. And then there's your narcissistic and privileged oppositional kids. We all know these kids. They've got poor guidelines, poor boundaries. They've never been told in life. They lack consequences. They kind of get what they want, especially when they engage in oppositional behaviors like nagging and escape. Adults in their life don't give them accountability for their actions or teach them accountability for their actions, so someone else is always to blame of, oh, it wasn't your fault, it was X or Y, Z faults. Every once in a while, sure, other people do things that make us act a certain way, but this is consistently blaming others for the child's behavior. These are kids who have always been pushed to make them feel good about themselves. and really rely on feeling good about themselves and people telling them how good they are about themselves. Their parents are constantly engaging in problem solving for them, so they're not taught how to problem solve. Adults in their lives are rushing to entertain them when they're bored or buy them new things, whatever it might be. And these are kids who have adults in their lives who cave as soon as there's that oppositional behavior, which absolutely it's very difficult to manage oppositional behaviors, but the more consistent that happens, the more we develop this narcissistic or privileged oppositional behavior. Let's talk about the underlying conditions. So typically when I have a parent come into my office who is concerned about ODD, I'm going to rule out everything else I can think of before I will diagnose it, because oppositional behaviors can come from other underlying mental and physical illnesses. ADHD being my first and foremost example. I'll have parents come in, they're lazy, they're stubborn, they don't want to do it. And then I do my ADHD evaluation. It turns out the child is sustaining attention to 1% of the information that's coming in because they're so highly inattentive that they can't pay attention to their environment. They're also impulsive, so they're acting without thinking. So they're engaging in what looks like oppositional behaviors. The difference with ADHD is that these kids have every good intent in the world. They want to do well, they want to please, they just don't see their role in the actions they're taking. Whereas your oppositional kids see their role. They recognize their role, they understand that what they're doing on purpose. Your ADHD kids are not. Learning disabilities. When I think about those big 10s, escaping the situation. If I don't like I've got a hidden math disorder, and suddenly I have to sit in a math class where I'm feeling bad about myself, you bet your butt I'm gonna act out of it because I'm either panicking or I've learned that I can escape the situation because adults have set poor boundaries with me in the past. So I'm gonna do everything in my power to get out of this math class because I would rather get in trouble because I'm in control of me getting in trouble than you making me feel stupid as a student. Same with language disabilities, especially my little kids. When I get a 3-year-old and parents are like, we have oppositional defiant disorder. Like, we don't have oppositional defiant disorder at 3. We probably have a language delay because if I can't express myself and I don't have the frontal lobes yet developed to handle my frustration, I'm going to act out. I'm going to be the 3 or 4-year-old who's biting, kicking, screaming because you don't understand what I'm trying to tell you, and I have no other way in my vocabulary to tell you that I am upset about that. So I'm going to resort to X, Y, and Z behavior. Anxiety and depression can also look like ODD. Depression symptoms include like not being able to get out of bed, not being able to self-motivate, forgetting, memory loss, it appears, even though it's not tried and true memory loss. All of these things where we want to get a child up and moving out of bed and they're doing everything in their power to refuse because their body just does not feel like getting up. Attachment disorders too. Reactive attachment disorder is really big in kids, especially from blended families, adopted kids, whatever the situation might be. There's severe postpartum depression that goes untreated for many years. Kids can develop attachment disorders that look like opposition because I'm doing everything in my power to get attention. My attention that I've gotten in the past, I got bad attention. So I'm just going to seek bad attention. I know exactly how I can get bad attention. But my end goal is attention, typically with the attachment disorders, or not taught about reciprocal empathy, social skills, things like that. PTSD, we talked about trauma already. And then giftedness. My gifted kids are the ones that where parents come in, it's like consequences don't work. It's like, correct, you have a little mini scientist who tries to push every single boundary and see where the line is. So your gifted kids typically are oppositional because they want to know exactly why something's done, why it's done the way it's done. And if it doesn't logically make sense to them, they're going to pick every hole in the argument and they're going to argue with you. It's not oppositional, it's a gifted trait. The downfall, especially with our new diagnostic manual, we have a bunch of researchers who haven't seen a patient in a while who create our diagnostic manuals. Now I can diagnose ODD with ADHD or with giftedness when that's not the true root of the behavior. So it's something I always caution everyone about. If you're seeing this, if you're getting this, question it. Make sure there's not a hidden diagnosis or an underlying diagnosis that's the true cause of the oppositional behavior before assuming it's a tried and true ODD. So with oppositional kids, what's most important is getting at what's called a functional behavior assessment. So this is understanding the function of the behavior and why kids do what they do, and understanding their motivation, because that'll help in creating a good treatment plan or good goals or good strategies within the classroom for them. So there's various functions, behaviors. The first is anxiety. Kids acting out of anxiety are going to flee a situation. They're going to escape. They're going to distract themselves. They're going to do whatever in their power to get out of a situation that's creating anxiety for them, even if it means being oppositional. So is there an underlying anxiety disorder that's driving this behavior? Escape. Do they act a certain way? Do they display one of these big 10 symptoms or behaviors to get out of a situation? Goes a little, you'll see some of these kind of bleed through. So it's really making sure it's a good understanding. Is it anxiety disorder, or is it I'm trying to escape the situation because it's unpleasant for me? So is the driving factor of the behavior trying to get out of a situation? Are they attention seeking? This one too is that it can be good attention, it can be bad attention. If the child cares about, or the adolescent cares about having all eyes on them or getting attention because they're missing attention in their life, or they feel like they're not getting attention, even if we are giving them attention, that might be one of the functions of behavior. The child is doing X, Y, and Z behavior because they're seeking attention from adults. Are they trying to fulfill a physical or a sensory need? Is this a kid with an underlying GI issue that we don't know, and so they're in chronic pain in their gut and they're not able to focus, and so now they're running away to go to the bathroom, or they're, embarrassed about X, Y, and Z, so now they're fleeing situations, they're doing certain things to get attention off of them? Or are they engaging in sensory seeking behaviors? Do they have a sensory processing disorder? And now we've got a kid who's screaming his head off, nobody can figure out why, but then he gets upset that other people are talking loudly in the classroom. There's some sort of sensory need that's not being fulfilled for this child. Is it pain? Goes along somewhat with that physical ability, that pain. Are we wanting to create pain, or are we avoiding pain? What is that function? Where does that come from? Or is the child trying to get control of the situation? Maybe they come from a household where they don't feel like they have control. It's a very chaotic environment. Are they just trying to seek some sort of control for themselves? This is especially true in our gifted kids who are oppositional. Are they seeking to control? Do they feel like they need to be in control of this situation? Is that the function of their behavior? And really understanding what the function is the first step in making positive change within the child's life, because you have to understand where the behavior is coming from to match an appropriate intervention style. The next step is to understand what motivates the child. So a lot of times I'll have parents, or when I worked in some of my level D schools, we've got Timmy who we're working on a behavior plan where we're going to decrease the number of times he says no to the teacher. So what are we going to do? We're going to implement a clip chart for him. If we see a good behavior, we're going to clip him up to a better color. If we see a bad behavior, we're going to clip him down to a negative color. Or a token economy. He can earn so many rewards, loses rewards he's already achieved, has to have so many marbles by the end of the week, and he gets this. Try it with the child. Use a clip chart example. Goes great the first day, gets a clip up, Great job, Timmy, you ended up on purple today. That's the best color. This was amazing. Next day, Timmy hasn't slept well the night before. Something happened. Maybe his parents and him got in a fight on the way to school, comes in with a bad mood, instantly clips down for negative behavior. Now Timmy's flipping tables and engaging in much more significant behaviors than what we're working on, because that's just not what motivates him. That clip down is not a motivating factor for him. And if anything else, it's going to make him mad. So understanding what motivates the child is also important, because if you mismatch your strategy with the motivation of the child, you're in for a world of hurt and behaviors are going to get significantly worse. So the different motivations that a child might have, the first is intrinsic. So this is, I would say, pretty rare in kids. I don't know many kids who are intrinsically motivated. They strive for praise for feeling good about themselves, for helping others, for increasing their own self-satisfaction. When they feel like they have accomplished something and they can see their accomplishment, they're going to work really hard, and that's going to drive their behavior and change their behavior over time. Mostly what I see is extrinsic motivation kids. These are kids that token economies work, that stickers work, that you can earn so much iPad time. You know, they're working for an end goal. These are your extrinsically motivated kids. Obviously, we all want kids to be intrinsically motivated. It would be ideal if you saw what you did, you were proud of yourself for doing that, the world would be so much easier. But not everyone is. A lot of kids are with that extrinsic. And also, too, if you think about brain development, our frontal lobes continue to develop until we're 30. So some of these kids don't see the intrinsic motivators until much later in life, mid-20s, when they're like, oh, that actually did make me feel good. It's about the job, it's about the career, it's about the money that's bringing in. There's that external motivation factor. Social is another motivation that kids have, that felt sense of belonging. So is this a kid who just feels like they need to belong to or with someone, whether it be a peer group, whether it be a teacher, whether it be their school, their classroom? Do they thrive off of this sense of belonging? And do they enjoy social contact? And the more social contact they have, the better their mood, the less behaviors we see. The next is attention. That one's pretty self-explanatory. Are they motivated by being recognized for their good behavior, for being noticed by others, for getting one-on-one attention because they did certain behaviors, because they engaged in certain behaviors, whether it be good or bad? What is that motivating factor? Do they just need and seek attention from others? Control is a big one too. Like I mentioned, it's really big with the gifted kids, but it's a lot of other kids as well. You know, I feel safest and I feel best about my life when I have control over my situation. Control is a hard one, especially for adults working with kids. Is we are the adult, you will do what I say. I hear myself saying that all of the time. But there are different ways to give kids a sense of control where you have ultimate control. So do kids need that sense of control to feel successful, to motivate them to engage in better behaviors than we're seeing? And also giving them some power over the decisions of, hey, this is what's going on. How do you want this to look like? This has to happen, so tell me what this looks like, how you would like to see it look. Engaging in some of the collaborative problem solving. There's a guy named Ross Green who does really good work for ODD kids. I really like his book, Treating the Explosive Child, because it breaks down for kids who need that sense of control, something called collaborative problem solving. So I'm going to tell you what I didn't like about that situation. You're going to tell me what you didn't like about that situation, or you're going to tell me your side of the story, then I'm going to tell you my side of the story. Okay, we have created a story together now. Now you tell me how we should remediate this. Now I'm going to tell you how we should remediate this. Your oppositional kids who are not ODD typically will come up with harsher punishments than you will as the adults. They're going to have these amazing consequences where you're like, that's really mean to yourself. Are you sure you want to do that? Because here's what I think would be a better consequence for that action. But really giving kids, engaging that collaborative approach, because you'd be really surprised at what some of them have to say. Other motivation factors. Sensory. Are they getting their physical needs met? Are they getting their visual needs met, their auditory needs met, their tactile needs met? I think about these kids who really need this deep pressure attention and just need the deep tissue hugs, things like that. Are they getting their sensory needs filled? Pain. Is there a motivating factor to engage in different behaviors? Avoiding pain. Getting assistance to help care for themselves. Caring for emotional pain too. Is relieving their emotional pain what's going to motivate them to change their behavior? Do kids engage in behaviors because of fear? Are they trying to mitigate fear? Do they have underdeveloped coping skills to deal with their fear, their anxiety, their worries, and they're just engaging in certain behaviors because it's what's worked for them in the past? It's a poor coping skill. Or are they accommodating their fears? Maybe they're a kid who's an escaper and they're escaping because they want to avoid fear. So how do we motivate them? How do we get them to understand that X, Y, and Z will help minimize that fear besides just running away, that there are other tools? And then escape, you know, for kids, especially when I think about motivation for our kids who are escapees, I really like things like assigned chores, special jobs. For these kids, I typically, my first recommendations is, you know, teachers on board, principals on board. We're gonna have just a stack of letters in teacher's drawer. Timmy said, amp up. I can see that he's starting to engage in perking behavior, so I can tell that an opposition is coming on because I'm starting to see bodily changes, sitting up more, talking more, louder, whatever that perking behavior might be. So I'm going to say, Timmy, I need you to run a really special errand for me. Take one of those pre-made letters. Will you go deliver to this principal? Timmy delivers a letter to the principal, says Timmy's having a hard time, tell him he's doing a great job, give him a hug or a high five, send him back to class. It just is that controlled escape so that they're still getting that need met, but in a way that you as the adults in their environment are controlling it. It reinforces too if you get that intrinsic that we want kids to develop. So you should be really proud of yourself. You're doing a good job today is what I'm hearing. Now go back to class. So they get that escape in there, but it's a constructive escape. Now, why behavior approaches fail? The most frequent reason why behavior approaches fail that you have put together in your classroom, in your household, whatever it might be, is that there's not enough work put up front to learn about the function of the behavior. Hey, I went to this training, I learned this thing, it sounded really cool, let's do it, before really understanding this will work for this child because the motivation and the function of the behavior are consistent with this discipline or this consequence style that we're engaging in. No information about what motivates the child. Again, we're just doing cookie cutter examples because we read this in a book somewhere, or we got this book and it sounded like this kid and it's very cookie cutter and it's not designed for this specific child. It's just something that was recommended to us, that was recommended to 500 other people. There's no question about what's going to motivate this child. Are we expecting them just to be intrinsically motivated? Are we expecting them to be extrinsically motivated? They just want stuff, when in reality they want attention or they need their sensory needs filled. Another reason is that there's no proactive measures built into the program, so we're just reactive. So when behaviors start up, we're just reacting to the situation. We have done nothing to be proactive and prevent these behaviors from happening. And the last is that kids aren't really being taught how to behave. I mean, when you think about what kindergarten, for example, used to be, it was how to stand in a line, how to take turns, how to be a good citizen in class. I worked in a kindergarten a few years ago. My kindergartners had to know 100 sight words by winter break. So we're not teaching kids how to behave. And if I'm against the tabula rasa, but if we take the tabula rasa example, we are no longer building that foundation for them to really know how to behave. So you'll ask the kid, what are you supposed to do? Be good. Tell me what be good means. Kids can't explain what that means. It's just they've been told 500 times that they need to behave, but not told what that looks like. There hasn't been, that foundation really hasn't been laid for them. So those are the big reasons why the behavior approaches fail. And what I think is most important for oppositional behaviors is proactive measures. We have to teach skills up front to decrease the oppositional behaviors. And this can be done not just with kindergartners, not just with preschoolers, but this can be done across the lifespan. You're gonna get your teenagers roll their eyes at you when you're teaching them social skills, but they're gonna benefit from it. You're gonna get more snarkiness from them than you would a kindergartner because it's not cool and creative fun time anymore, but they're going to learn and they need to be taught these skills. So proactive measures that can be taken within the school, within the home, whatever it might be. The first is physical movement and exercise. Exercise has really great emotional benefits. I laugh, I'm gonna date myself, but I always think of Legally Blonde. And a big court case in it is that exercise releases endorphins. Endorphins make you happy, and happy people just don't kill other people. That is absolutely true. I like that Mackenzie gets my reference. you need exercise in your life. It's releasing all the correct chemicals to help your brain, especially when we get a tried and true ODD kid who has a chemical balance within their brain that is creating them to act this way. It's a brain-based disorder. If we increase exercise, we increase those happy chemicals, reduces stress, increases positive energy. Now, a lot of the times we see kids with a lot of energy, it might be I'm tired energy, not actual positive energy that we want to see. And what's really important is that exercise and movement and all of these things be done in a non-competitive activity. Because if we're doing, okay, we're all going to go play tag, or we're going to go, do whatever competitive sport to burn our energy off, your oppositional kids are going to take it as a challenge, and we're setting them up for failure by putting them in that situation. So it's very non-competitive activities where we're just burning fuel, getting movement, getting a nice serotonin, dopamine, norepinephrine hit. We also want to help kids develop confidence. Adults definitely shape the path of achievement. There's a big nature versus nurture argument. I very fully believe it's both, that some of this is very natural. Kids are going to engage in oppositional behaviors, but your kid's environment is important as well. So building up confidence, putting kids in certain situations where we know they're going to be successful. Timmy doesn't like math, but he really likes helping out the younger grades. So I'm going to make sure he gets time every day to be a mentor for those younger grades, because that is going to give him confidence and build up these skills before oppositional behavior starts. Confidence allows for appropriate risks. So I have confidence I'm going to, not negative risky behavior, but positive risks. I'm going to step out of my comfort zone and try something I'm not good at because I have confidence. So I'm more likely, I think about a lot of oppositional kids are in chaotic environments and they thrive off of that chaos because it's their normal. You put them in a structured environment, now we're having increased oppositional behaviors because this isn't what I know, this is uncomfortable for me. So if we build up that confidence before they're put in a different situation, they're more willing to take risks, quote unquote, and engage in good behaviors that they otherwise might not, especially these kids who are in an environment where they have to fight to survive. And overindulged kids, I think about those narcissistic kids, privileged ODD kids. Overindulged children need to learn the difference between what they're good at, what they're not good at, and what they're trying to be good at. That there are things you're going to fail at, and that's okay. Everybody fails. There are things that you want to be good at, and these are the steps that you need to take. Very overt, clear instruction. This is what you need to do to X, Y, and Z. So really that reality check is good. Again, understanding the type of oppositional behavior is going to drive what works and what doesn't work for these kids. Build competency with them. This is academic as well as social competency. So I think of when we create goals for kids, our end goal might be this big, wonderful thing. Timmy's not going to, throw his desk anymore. But we have to have small, achievable goals along the way that he can achieve within a few days. Because if we're not seeing successes right away, we're not feeling competent. Behaviors are going to start to spiral out of control. So really having those small goals as well as the large end goal, but making sure those small goals are really small and easily achievable, because a lot of the times we'll set goals for kids. They'll get very excited. They're like, I absolutely want to do X, Y, and Z. I'm going to do this. And then they fail right away. So then they don't feel competent. And so we're back to square one, or we're a few steps back than where we started because we set our goal way too big in the first step. So having those small achievable goals. And also fostering a sense of belonging. This is definitely something that is a school-wide, a home-wide concern. It's got to be at that bigger level. So creating an environment that's connected and welcoming. This is having bullying prevention, for example, not just talking the talk, but walking the walk. I've been in a lot of schools where, oh, we are X, Y, and Z, we are caring, we do, yada, yada, yada. This is we say these great things every morning on announcements where we just show the kids that this is a welcoming environment. And then you turn around, Timmy's stepped out of line and now he's getting snapped at and doing the opposite of what they just talked about over announcements. So really creating and walking the walk in that environment that's connecting and welcoming. Creating a trusting environment that comes with consistency and routine of, I respond the exact same way to you every time you engage in this behavior so that you can trust where I'm gonna be when you do X, Y, and Z. So I am very consistent in how I respond to this. And then when I have a bad day, because we all have a bad day where we're not consistent, having that conversation, being open with, I had a bad day, I responded differently. This is what I noticed about it. Going back to that collaborative problem solving, tell me what you noticed about it. Let's create the story of what happened. Let's figure out how we can fix this. And then building strong positive relationships among the students, the parents, and the staff. All three have to be in line, especially for oppositional kids. Parents, teachers, gotta be on the same wavelength, and building that positive relationship between all. So parents aren't going home bad-mouthing to the teacher for X, Y, Z. If student says something about parent or about teacher, everyone's nipping that in the butt right away. Is that we are all on the same page, we're all open, we all have strong lines of communication, so that we can recognize our relationship. Ensuring a safe and positive school environment. This goes back, but promoting respect, responsibility, and kindness. These are the core foundations of our school. Preventing negative behaviors such as bullying, so really engaging in that bullying prevention and constantly reminding students about what that prevention looks like and constantly practicing it, because all of these things that I'm talking about need to be consistently practiced. If they're only done every once in a while, we've now shown that we're not consistent on how we respond, so it gives kids a little bit of wiggle room to increase oppositional behaviors. Provide and review the rules of conduct and their consequences. And I'm not talking once a quarter. I'm talking we're going over this really hard at the beginning of the school year, and we're doing weekly, bi-weekly, monthly reminders of what this is, whatever you feel out the classroom or you feel out at home, what is necessary, but really frequent review of the rules. It sounds repetitive, it sounds redundant, there's so many other things you gotta do in the day, but to decrease oppositional behaviors, you gotta put up that work up front. And then teaching kids how to stand up for bullying and practicing it too. The next big one is ensuring access to school-based mental health, mostly to reduce the stigma, especially with oppositional defiant kids. Like I said earlier, I've been in a lot of programs where kids will have that emotional disability diagnosis, that ODD, and there's a lot of stigma around it. We're dealing with a pretty significant anxiety disorder, a pretty significant ADHD that's resulting in oppositional behaviors. The more conversations we have about that and the more we engage as mental health professionals and in that multidisciplinary approach, the less of a stigma is, the easier it's going to be to help provide kids with help. And like I said, oppositional defiant disorder by itself occurs in only 3% of the population, so your comorbidity is a rule rather than an exception. If we've got an ODD and we're not sure, child's never been tested, we have these major oppositional behaviors, we really want to make sure there is nothing else going on before we start to engage in some of these methods. Because if there's an underlying disorder, everything I'm giving you right now that'll help oppositional kids might be ineffective because we haven't treated that underlying condition. So with oppositional behaviors, comorbidity is a rule, it's not an exception. We also have to teach direct skills. So kids aren't taught skills anymore, but kids need to be taught social skills, coping skills, and executive functioning skills, or executive coping skills, whatever you want. I combine two of them. But your social skills, they need to be taught manners, conflict resolution, getting along with others. Is there a program in your school? Are they doing extra work at home where we work on conflict resolution? We attend, we have peer mentors, we have peer mediators that are taught how to do this and can demonstrate to other students how to engage in conflict resolution, because it's not a skill any one of us is born with. It takes time, it takes practice, and it takes a lot of overt teaching. This is how you manage a conflict. This is how you resolve a conflict appropriately. And kids need to be taught how to get along with each other. especially, you know, with technology and with like internet trolls, there's so much anonymity. We need to be taught how to get along, that what you say online or what you say over TikTok or Snapchat follows you to school the next day when you have to see these kids face to face. Anonymity is not a thing for kids at all. And so really helping them recognize that you need to get along with others, and this is how you get along with others. This is how you get along with people who don't think the way you do, who don't have the same interests as you. Kids need to be taught how to deal with stress. Here are appropriate coping mechanisms. What you're engaging in is inappropriate. You might be, you know, distracting yourself, which at home is great. There's something going on that you're really worried about. I want you to distract yourself from that worry. But when you're in the classroom learning, I don't want you to distract yourself. So instead, I want you to do X, Y, and Z. I want you to ask for a bathroom break. I want you to, you know, have a safe zone, have a safe word with me so that we know you need your needs met, or you have to get your needs met right now. And then executive functioning skills. Kids will develop these over time. Executive functioning is primarily frontal lobe. That keeps growing until you're 30. But teaching kids the coping skills will then help with emotional regulation and impulse control. For executive functioning skills too, in the classroom, I like saying things to kids like, you know, you finished that test really fast. You've still got 10 minutes. Why don't you go back and double check your work? You know, some of those cues that are typical executive function that you and I would think to do because our brains are fully developed, that a child might not do. And then what's really important is establishing and practicing crisis management. Because you don't want to get to a crisis situation where Timmy is now flipping over a desk and raging and being aggressive towards others and not know how to manage it. So having a crisis management team, like in your school, a crisis management team in your school is very important. Having it the same people every time and having those individuals train the same way and practice what are we going to do in a crisis situation. So establishing a crisis response team on your campus and being prepared for crises by practicing. The more practiced you are, the more it becomes procedural memory and you just snap right into it, so that instead of getting caught in a situation where now we have a scary oppositional behavior, it's just muscle memory. I jump right into action and this is what I'm going to do. So practicing and establishing that crisis management team is key. There's a lot of different programs around the Valley where they'll teach you how to de-escalate situations. If we had more time, I would teach you how to de-escalate a few situations, but I want to be mindful of everyone's time since we are running a little late. But there are different modalities you can take to de-escalating situations and making sure that everyone's trained in the same one. So that one person isn't trying a non-invasive crisis management approach where another individual is going hands-on with a student. We want to make sure everyone's the same and there's consistency within our staff. Two really good resources. The one I mentioned, Treating Explosive Kids by Russ Green. I didn't put that in here, but I'll put it in the chat box so you have it. Two really good books. One for understanding oppositional kids is Oppositional Defiant Disruptive Children and Adolescents by Scott Waltz. And then a good book for kids with oppositional behaviors is The Survival Guide for Kids with Challenging Behaviors. It's more of an activity book, walks kids step by step of, hey, you and I both agree this isn't working for us, we're fighting, we don't want to fight. How do we fix this? How do we, you know, on our own terms, come to terms with this? Survival Guide for Kids with Challenging Behaviors is a really good book for oppositional kids. So that's all I had. Very fast, quick nutshell. I will open it up for questions, and here's all my contact information. Should your question not get answered.
Thank you so much. That was such an informative presentation. I know a couple of people had asked about getting a copy of your presentation. Would you be willing to share? Awesome.
When you can distribute those?
Yeah, I'll send it out to everyone tomorrow, so that would be greatly appreciated. Are there any other questions for Dr. Ball?
I have a question, actually. First, I want to say thank you. That was very informative. I really appreciate that, because I often wonder if it's ADHD or ODD. It can be very challenging to discern, you know, I mean, it's just really tough. So I love the description you gave about how to tell the difference. That's really helpful to me. And I know that's going to be helpful to a lot of other parents. And I would love to connect with you to see if maybe you do these types of presentations. I'm actually with Sounds of Autism, and I am a mom of autism. And so I would love to connect at some point and get your information, because this was a fabulous presentation. Thank you so much for putting this on, Patrick and Mackenzie. I greatly appreciate it. You guys are doing a fabulous job with all the webinars that you're providing to our families, and we're grateful. So thank you.
Wonderful. Yeah, my contact information will be on those slides, but if you want more resources, let me know. Shoot me an email or call me. Any other questions?
Guys are taking it easy on Dr.
Make it easy. What the heck?
Well, okay, I'm going to ask another one then, real quick. Do you do so, Doctor? Do you? I don't know if you're local or not. I don't know if your office is here because I didn't see your contact information.
Yes. Oh, I'm sorry. I jumped it off the screen too fast. So I'm at Belgian Psychological Services. So I am in the North Scottsdale area. I do pediatric neuropsych evaluations, independent education evaluations, psychoeducational evaluations, gifted evaluations. I work with families in the school system. I do a wide range of things. So I am local here in the Valley, and yeah.
Fabulous. Great.
Mm-hmm.
Thank you.
Any other questions? All right. Well, thank you again, Dr. Ball. It was so great to have you here. And thank you
for having me.
Attendees this evening for joining us. Our next webinar will be on September 16th at 5 p.m. and that is executive functioning, practical tips for parents and teachers at home and in school. So hope to see you all there, and thank you again for attending. Have a great evening, everyone. Bye-bye.